At American Addiction Centers, we understand what it means when the search for addiction treatment begins, and we work hard to make sure the process is as easy and stress-free as possible.
You've taken a big step by reaching out and calling us. I know this can be...
Whether you're searching for addiction treatment for yourself or for a loved one, there are some things to consider having on hand before calling. The insurance card from the provider, Social Security card or number, date of birth, home address, and the name of the employer. When you call in, an admissions navigator will greet you and obtain that information and other things regarding addiction. When the time comes to verify insurance, admissions navigators work with our insurance verification team.
Once the navigators receive information from potential clients, we call the insurance company, verify substance abuse benefits, making sure that all of the levels of care, there are 5 levels, we want to make sure all of those levels of care are covered. If they're not covered, we want to make sure that the client is aware up front. And we give the determination as far as what the out-of-pocket would be upfront cost, the deductible typically, or any co-pays. Send that back to the navigator. When the navigator calls the client back to give them their information, insurance and out-of-pocket, if the client has questions that the navigator can't answer, they're put in a request for us to do an insurance counseling call, and we'll call the client or the loved one, whoever is needing to be explained. A lot of times we speak with parents to explain the insurance information as far as what their in-network benefits are, what their out-of-network benefits are. We can't determine the levels of care that's done at the facility, but we give them a full detail of in-network benefits versus out-of-network benefits, what's remaining.
Understanding deductibles, co-pays, and patient financial responsibility can be confusing and sometimes overwhelming, especially while in treatment. Our facility business office teams are there to help patients understand their individual financial situation and develop a plan that doesn't interfere with treatment. Our utilization review team works closely with the patient's clinical team and advocate in making sure their stay is authorized by their insurance. They provide updates on how the patient is progressing, and their goal is to make sure patients receive the appropriate level of care while admitted with us. As with addiction, everybody's circumstance is different, and these options will vary depending on the individual. There are a variety of different methods you could use, including insurance, private pay, and personal loans. American Addiction Centers will also work with individuals on payment plans. It's important to call and discuss these matters and to learn about the options and more about what might be right for you and your family. Families that decide to accept the help that an addiction treatment plan can offer are investing in the future health, well-being, and success of their families, both now and in years to come.